The skin on the eyelids is pretty thin, and we lose elasticity in our skin everywhere. And when you're already starting with a very, very thin layer of skin, you lose some elasticity and you see it more. I think we blink something like 17,000 times a day. And so just that action sort of wears things out a little bit. And then just there's a lot of animation around the eyes. When we smile, when we close our eyes tight, if we sneeze, whatever, there's just a lot of movement around our eyes. And that also wrinkles and crinkles the skin. And all of those things create lines and then there's, sun damage and all of these things also sort of add to the aging of the eyes. And that's true for the skin. As far as the lower eyelids, there is a septum that kind of holds the fat in place because there's actually a lot of fat around our eyes. It pads them so they can kind of glide and the muscles can kind of glide. But when that septum on the lower eyelid, and sometimes in an area right by the nose on the upper eyelid, those septums can get a little weak. And sometimes they even have little gaps or kind of spaces where the fat can bulge forward. And when that happens, it pushes everything forward and creates shadows under your eyes. I think pretty consistently by our 40s, everybody's noticing a little bit of change. There are some folks, even some children, that will have that little puffy pocket of fat under their eyelids, even as children. And so sometimes people will come in their earlier years, 20s, 30s, and ask about it. Sometimes it's rare that somebody in their 20s is truly ready for eyelid surgery, but every now and then there's somebody who may have that sort of more congenital bulging of that fat pocket or a little herniation of that fat pocket. But otherwise, yeah, 40s and beyond is what's most common. Eventually, the upper eyelid skin, if it gets heavy enough, if it hangs down low enough, it can start to block some of the vision, the peripheral vision. We talk about visual field obstruction. And so it's kind of like when you see horses in Central Park or whatever with the blinders on, that starts to happen and people can't see out the corners of their eyes as well, which can affect with driving or in Portland, bike riding, et cetera. And so you got to be able to ride your bike and see those cars. Yeah, so that's where we start seeing visual field. It also is fatiguing, and their eyes will be tired by the end of the day, and they have a hard time getting through their day of work or what have you before their eyes just get kind of worn out because those little thin muscles are trying to hold a lot of extra skin, do a lot of extra work.